Welcome. Thank you everybody for coming. My name is Joanna Wendell. I'm the lead communications consultant for the Congregation Neveh Shalom COVID-19 Outreach and Services team. We are an OHA funded group providing COVID related assistance to the sort of Portland and surrounding area Jewish community. It's a great group. We're hoping that, we're helping you out a lot, bringing you news and important updates and whatever services you need. If you can check out our website, nevehshalom.org/COVID-19 to learn how to contact us. We also have a newsletter, a weekly newsletter that you can sign up for, also on our website. And then one event I do want to plug before we start. This Sunday in the parking lot of the MJCC, we're having a drive-through flu shot and COVID test clinic from 1 to 3 p.m. And if you are interested, we sent out an email or a link in our weekly newsletter to sign up. If you don't have that, please let us know and we can get you a link to sign up for that. It's free flu shots. COVID tests are not free, but if you're in need, we can provide a very limited supply of funded COVID tests. So just let us know. And we also have we'll be handing out masks, hand sanitizers, some Halloween treats, and if you or somebody you know needs this service but can't drive or doesn't drive, we have taxi vouchers that we can provide for people. So again, Essie, if you can post our email in the chat, if you have any questions about the event, need the link to sign up, or maybe Essie, you can post the link to sign up in the chat as well. So that's this Sunday, 1 to 3. Okay, so welcome. I'm here with my friend and colleague, Erin Ross. She is an amazing science writer, science communicator. She's a former disease ecologist, museum educator. She has written and produced work for Axios, NPR, Scientific American, Nature, Science, and now she's science writer for OPB, science reporter for OPB. She's also their lead COVID-19 reporter. So for Oregon COVID-19 news, she's the absolute one person I would want to be talking to about all of this. So I'm very excited to have her here. I am now going to spotlight her so everyone can see her face even bigger. And we're just gonna jump right into questions. So Erin, the first question I thought that was sort of a really good intro into this topic. We get these case numbers. If you get the OHA email, you get these case numbers every day. And what our audience would like to know, how accurate are these numbers daily? And are there maybe more than is being reported, less? I mean, what kind of accuracy are we getting from these numbers?
Yeah, so the numbers are kind of a little bit tricky. They just changed the way that they report them. And so right now, when you get an email with the numbers, you are seeing the number of new cases that were diagnosed that day. But then when you look back in time, what they actually do is they assign the case to when they started showing symptoms, or when they first got tested, not when the test was received. So that's one thing that can make the numbers a little bit wonky. But as a whole, I mean, we know that we aren't catching every COVID-19 case. That's just confirmed. There's a lot of community spread happening. Like in Multnomah County, I was just looking, I think last week we had I think a third of our cases were sporadic, which means that they weren't able to trace them back to a previously existing case. So that means that we can't be finding them all, because then you would be able to see the previously existing case. We can try to kind of look at hospitalization rates, for example, which are going to be a bit more steady, and compare those to kind of use the percents to eyeball it out. So OHA estimates that there are about 4 to 5 times more cases in Oregon than they're finding. Some places put the estimate as much as 10 times as many. But yeah, they do it's acknowledged that these are only confirmed or suspected COVID-19 cases in the count.
Yeah. So with that number, I mean, that's way higher than I expected. With that number, I mean, what does that mean for, you know, we're all getting pandemic fatigue, right? We all are like, I just want to have a friend over for a little while, you know, like with that in mind, what does that mean for, you know, keeping up our efforts to stay safe?
You know, really I pulled some numbers earlier just to try and get like an example, because like you were saying, you hear these case numbers all the time, right? And they kind of just start to feel routine. Like, you know, we had 480 cases last week. That was a new daily record. And I was like, wow, that doesn't feel much higher than our last daily record. And, you know, it's kind of like dissonance when you see it that way. And so I just pulled like the numbers nationally, looking at statistics for other diseases. So just for example, in 2017, right, across the course of your entire life, like of all adults in 2017, 23 million of them had a cancer diagnosis. And right now, out of, you know, we're at 38 weeks into COVID in the US, we're looking at 7 million people who have been diagnosed with COVID that year. So in 2017, 23 million people had ever had cancer.
Wow.
And yeah, so these numbers are really, really high. And then when you look at the fatality rates, they're also really high. We're about halfway to meeting the same fatality rate as cancer. We're at like 3 or 4 times now what the fatality rate is for the flu.
Wow.
That's nationally, not in Oregon. Our numbers are relatively low nationally, but I mean, looking into winter, it's going to be a really hard winter. It's going to be pretty long. We're seeing in other countries lockdowns returning. France just issued a curfew. And yeah, as cases continue to rise going into the winter, I would expect to see maybe some things roll back a little bit, or we're just going to be seeing a lot of stressed hospitals, that the case count is increasing a lot faster than OHA would like to see.
Yeah, so with that in mind, what are sort of the more riskier places that you can, when you have to go out, and when you have to be in public, you know, the airport, stores, church, bars. So what's kind of the risk level associated with these public spaces?
The biggest thing to consider with any space that you're in is going to be the time that you are exposed to someone, the amount of exposure, and the proximity. So like if you're wearing a mask and they're wearing a mask, that's going to take down your risk a lot with the amount of exposure that you're getting. And then proximity would be how close you are, and that definitely depends on if you're indoors or outdoors. Like indoors, 6 feet, it is not going to do a lot for you. That's what we've kind of been learning recently, is that being 6 feet apart outside means nothing. Outside, sure, great. So that would also be like that proximity, and then how long you spend with them. So like your encounter, if the checkout person at the grocery store has COVID, you're probably not going to get it from them.
If you're both wearing a mask.
If you're both wearing masks, yeah, because you aren't exposed for very long. They have a barrier, you're a certain distance apart, you have a mask over your face. Now, if you're being exposed to a store that's full of people, that's going to be a different case, right? So you have a lot more chances for that one little instance to happen. The places I would avoid the most are anywhere that you take off your mask indoors with other people, just any situation like that. And that would especially be bars and restaurants, because you can't eat with a mask on, you just can't. And if you do go to a bar, I recommend using a straw when you drink so you can keep your mask on.
Oh, interesting.
Yeah. And you know, you don't know what the ventilation is like in all of these places. People get really worried about public transit and airplanes. Those actually don't seem to be that big. Airplane air circulates pretty quickly. And in terms of like kind of your bubble, you're really only being exposed to the row in front and the row behind you for a significant amount of time, just given how fast the air moves. And if you're on a plane without a middle seat, that's actually even better. So you're still in, you know, kind of limited exposure. Definitely try to stay with people who you can keep track of. You don't want to be in a place with strangers, because then if you interacted with them and they get sick, you will never find out. So stay at your house.
The other thing that I think about, because I take the bus every once in a while, or when I'm in a ride share, is that, you know, no one's talking to each other. So we're all just sort of like breathing behind our masks, not, you know, projectiling spittle at each other because we're not talking. But, you know, I have avoided taking the Max train because it's sort of a closed tube, and there's no like official there to enforce mask wearing. So is that, I mean, am I sort of overthinking it and being paranoid, or am I making the right choice and avoiding the mask and just sticking with the bus where you're not going to be let on if you don't have a mask, and also I can open the windows if I need to?
I think, you know, I'm not sure how much people do comply on the max or don't comply. So that would be like one thing is, you know, like walking in and if everybody has a mask on, I might feel less nervous. If I walk in and nobody has a mask on, I'm not taking that train. Yeah. That actually reminds me though that, and I really have to wonder if something like this exists for Portland or if we could ever get it done. But Joanna and I have a mutual friend, Sarah Kaplan, who writes for the Post, and she looked up the air circulation on the subways in New York to figure out the safest way to take them. And they would be just stand near the doors, like stand near the entrance and exit. It's going to open and close a lot. That's more airflow. I thought that was kind of adorable and awesome.
Yeah, interesting. So what if somebody is flying later this month? What steps can they take to stay healthy?
Definitely quarantine before you fly, and when you arrive where you're going, know who you're going to be with. Like, get off of the plane assuming that you have been sick, that you've been exposed and you're sick, and get onto the plane also making that assumption. So if you assume that like kind of like every person around you is a potential danger, right, then you're going to want to, that's just going to make you be more careful. Things like wiping down the seats might help, but that's not going to be the biggest concern. It's just going to be wearing masks. If people aren't wearing masks on your flight, aren't wearing them properly, you should talk to the stewardess. All the airlines have a zero tolerance policy. Not all of them enforce it, but if they don't enforce it, then you should be documenting that. But in terms of keeping yourself safe, you know, definitely don't book on a flight that puts in middle seats. I mean, you're increasing the chances that you'll get exposed to COVID by 30% when you do that. And so that's just going to be a lot more. Bring a straw for drinking on the plane, eat before and after. They aren't providing food on planes anymore, but that's partly to stop you from taking off your mask. Like again, you got to take it off to eat. So have a big meal before you get on the plane, bring snacks to eat as soon as you get off, wash your hands a lot. And yeah, try not to touch your face.
Yeah.
Standard rules.
So we had a lot of questions about schools coming in. So, you know, one question, you know, schools in other states are maybe showing that kids under the age of 10 are not super spreaders. So in Oregon, is there any science to support the continued closure of schools, you know, especially for these younger kids?
So in Oregon, looking at our own data, it's kind of tricky because our contact tracing capabilities aren't very good. And honestly, most places in the US aren't great either. It seems like kids aren't necessarily super spreaders, but you also have to keep in mind like where the kids are coming from and how they're interacting and who they're interacting with. So like kids going to school occasionally who are at home with their parents and never leave their house have a very low chance of being a super spreader. Like it's way more likely that an adult's just going to catch it in the first place. Like there's just kind of a lot of confounding variables around the age thing. It's not a question that has any sort of like, there's no definitive answer on it. And so you can't, like we can look at other countries where we have seen some outbreaks related to elementary schools being open and some where we haven't. It's really kind of, we really don't have a good handle on like why some places have big outbreaks and other places don't yet. So, you know, in absence of evidence doesn't mean that it's safe is what I would say, is we don't have evidence of spread in schools, but we also don't have evidence of spread in bars and restaurants. And that's really just comes down to the capabilities of the tracing that we can do, especially knowing that, you know, if a kid gets sick, they're probably going to be asymptomatic. And so you might not even make the connection that, you know, these two kids happen to get their parents sick totally across town. You might not connect that back to the school.
Yeah. So then sort of to follow up on that, you know, there's some confusion about why schools are closing, but, you know, the state is allowing bars and restaurants to be open. And it seems like bars and restaurants, like you sort of said before, the exact right place to spread the virus. You're talking, you're close, you're in a poor ventilated area. So what's from your point of view, like what's going on here? Like, why are we keeping schools closed, but allowing restaurants and bars to be open?
Yeah. You know, there's definitely, if you ask that question to the governor, what she will say is that we have to balance business interests and the ability to keep people employed with COVID-19. If you talk to politicians representing Eastern Oregon districts who were very, very lockdown resistant, right? They do not like the lockdown. Many of them have said that they would happily have bars and restaurants be closed if that then meant that they could have their kids go back to school. They're kind of willing to, like, because with everything, you know, you have this much more transmission, so you have to cut it somewhere else to make that work.
Right.
But like, there's this sort of assumption, right, that the options are either because restaurants are on like razor thin profit margins. So there's this assumption that like either you support restaurants or you support health. And that's kind of an unfair balance though, right? Like there should be a way to do both of these things. We shouldn't need to be sacrificing people's jobs and able to make sure that people don't die.
Right.
So it's not really any good answer to that. I don't necessarily think that any government institution is set up to answer that question or to solve that problem. But yeah, it's unfortunate. And you have to really feel for the small business owners who are just struggling to stay afloat. So many businesses are going to close and not come back.
Right.
And that's going to happen.
So sort of two follow-ups to that, that were, you know, in the questions that people submitted, you know, what do you kind of foresee for schools sort of in the next 6 to 8 months?
We are going to see some schools start to open more. The governor and local representatives are currently reconsidering the guidelines for a lot of schools. And part of that is just that like the metrics that they sent aren't necessarily feasible in some counties. Like, for example, which county is it? It's the least populous where Wheeler and John Day are. Wheeler, yeah, where Wheeler and John Day are. That county has something like 9,000 or 10,000 people. And if they get like a single COVID case, that puts them over their threshold if they have just one case. Yeah. And you have like the two biggest towns aren't even geographically attached by any major roads. Like people aren't traveling in between these places. Biggest town is 800 people. It's not like commuting to or from Salem where everything's interconnected. And so, you know, if you get like one case in John Day and then the high school in Wheeler 2 hours away has to close, it gets a little weird. So they're going to start reopening more schools. They're also going to be doing a lot of schools are already open a little bit to like distanced learning. So they'll allow in like kids on like a rotating schedule for only so much time a day, only so many kids, and they're prioritizing kids with extra needs. And I think as it becomes increasingly clear how much we need to be able to continue to meet the needs of those kids, we'll probably see more schools opening along those lines. But
is any of that happening kind of in this area? So like Multnomah, Washington, Clackamas, that's where the CNS cause community, those are the communities we serve. Yeah.
I mean, part of the thing is that like it is very much county by county decision whether or not they're going to open the schools. The guidelines are OHA's baseline. And Multnomah County has been pretty consistent in saying that they aren't going to open schools until it's safe to do so. But like some schools in Multnomah County have already been open for special needs children and special services. But again, it's like super, you know, this is something like maybe 20 kids going to a school a day. This is not the same as, it's not an in-person class. It's like they're going and getting their occupational therapy and like their speech therapy and these services that they need.
Gotcha.
Yeah.
That's great. Yeah. So then, you know, with our other things, sort of, you know, restaurants and bars, as we get into the Oregon rainy season, cold season, you know, what do you think is going to happen? Do you think we're going to be seeing more shutdowns?
I mean, cases are going to go up. Like we're already seeing across the country an increase in cases associated with small gatherings. And that's not because small gatherings are a big transmission place. It's that more of those small gatherings are moving indoors. And we're going to be running out of things to do outside. I mean, I still go out in the rain because, you know, it's Oregon, you have to. But it's going to be a lot harder to have a picnic with 5 or 6 friends. And people want to be close to other people. Like, I love seeing you over a computer, Joanna, but I love seeing you more in person.
Oh.
And we need that as social creatures. Right. So cases are going to go up. The question of whether or not we might see another shutdown is pretty up in the air just because there's so much political opposition. Scientifically, there is every case for another shutdown. There was a case for another shutdown back in July when we could barely contact trace 70% of the cases in Multnomah County. Because if you have too many cases, you can't contact trace it. So if you shut it down, then you can get the cases to a level where you can then trace and isolate just those cases. So there's a very good scientific argument for like another 2-week lockdown or something similar. Whether or not that happens, I think is going to really depend just on how the the elected leaders in Oregon choose to weigh the costs and benefits.
Right. Is there a way, if we have concerned citizens who, I know when I walk by Act Restaurant, I'm just like, I don't understand, who, feel frustrated that maybe our leaders aren't listening. What are some ways that people can kind of, to use the cliche phrase, make their voices heard with their, concerns for safety like this?
Absolutely calling representatives. I mean, they really genuinely do listen to calls from their constituents because you are the people who vote them in. And so, talk to your representatives, tell them what you want, whether it's schools to be open or closed or any of those things. That's the input that they're taking into account because they don't live the same lives as most of their constituents do. And again, they want to keep getting elected. So definitely just keep the pressure on them. But I definitely, I think feeling that rage is kind of a normal thing to feel too. It can feel like people who are staying indoors are sacrificing a lot. And then a few people are, frat parties have very recently emerged in Oregon now that they're open again as a big source of transmission. And so it's easy to get angry when you see people doing something that you aren't allowing yourself to do, which can be hard, but there's just no good system for to really address that, other than just calling your representatives.
Right. So in terms of timeline for this whole thing, it feels kind of like a never-ending crisis. Is there a scientific or evidence-based timeline at all for getting back to whatever normal means for a post-pandemic Oregon? Somebody who sent in a question said that they've heard reports that will be restricted to small groups until 2022.
I think it's certainly possible that some places could be. Once a vaccine rolls out, even if all of our wildest hopes and dreams come true, and we have a vaccine that is confirmed safe, past phase 3, good to go January 1st, even with the stockpiles that we've been making, that initial vaccination is just going to go to frontline workers and people who are working in healthcare. And then it's going to go on to people who are at risk. So like giving it to the elderly, going to different nursing homes and nursing facilities, people who work with them, and then kind of trickling out. It's not going to just be like this massive deployment where everyone can get it everywhere all at once. Right. And so because of that, each of those vaccines is going to give you a little bit more immunity, but also you're not going to reach herd immunity for a long time. And if you kind of think of it like a vaccine is sort of like social distancing, like you are basically making yourself a barrier and end stop for that virus. So each of these things that you take, these extra steps on top of that vaccine, is just like one more layer of safety. Now, what that's going to mean for lockdowns and reopening is probably going to vary a lot from place to place. I mean, we saw our cases drop a lot in the summer in Oregon. That's in large part because we were outside so much. So, we might find that like maybe we only get enough people vaccinated that in the spring we're still distancing, but in the summertime, maybe we can have like a concert on a lawn where everyone is sitting 6 feet apart, but we can have a concert. Who knows? It's hard to think about going this way until 2022. And when I think about it, I just try to remind myself to kind of play the long game and to be kind to myself when I need to, taking time to do the things that make me happy, letting myself see friends as long as I like keep track of it and have really honest conversations about potential exposure history. Just being upfront about those things and asking those questions, and then making a point to be like, okay, I saw this person on this day, and then keeping track of that. Like each additional person that you see is going to be another complication. So just trying to limit your interactions, but like take what you need and be ready for a long haul, like fortify yourself.
Yeah. So, I mean, what would you recommend as a good strategy for those times when you just need to be with people, right? We are not, islands. We have to see people. So in the event that it's 30 degrees outside and sleeting and you just need a human, or you and three friends want to get together and make a plan to all be safe, like what kinds of steps would you suggest that people take?
Yeah, I would have upfront conversations about your expectations. Like, I went on a trip. I flew to New York. I stayed with four friends. We didn't see anybody else outside of those four friends, and then I went back. And we all agreed to quarantine beforehand. We all went together knowing that we all could have been exposed on the plane. And then after I came back, I started 2 weeks. Now, I think that's a lot to do for like, say, meeting a friend in person. This was back in July. We didn't really know as much about like where things were spreading yet. But if you really need to see a friend, call up your friend and say like, hey, how safe have you been? Like I went to the grocery store on Tuesday and I hung out with two friends on Thursday. Do you feel safe coming over? Like, this is my exposure. Like I have a really good friend who canceled a plan to hang out because she was staying at her boyfriend's house, or her boyfriend's apartment, and his roommates, like 13 cousins, just showed up out of nowhere.
Gosh.
Unannounced.
Wow.
And had been like traveling and showed up. And so she called me and she was like, hey, if you still want to hang out, we can, but this is what just happened. So if you don't feel safe, that's okay. And I was like, yeah, thank you so much for telling me. I'll, see you again in 10 days.
Yeah. Yeah. And, what about, having a pod? Like if you and another family, or, you have extended family in the city and want to be a pod. So what goes on there?
Pods can be a good idea. The idea with a pod is that you're picking people who are the only people who you see and you don't see anyone else, so that you can be kind of mutual dead ends.
Mm-hmm.
But it's a lot easier in theory than it is in practice. Each person you add to a pod is another potential layer of exposure. And let's say like, I'm in a pod with 3 other people, and 2 of those people maybe have roommates, and then those roommates aren't in the pod. So there's still going to be stuff coming in and out. And so just having the real conversations is what matters the most. I mean, definitely like I have a core group of friends that I know I can see safely. Like I know that we have similar safety standards, and if something happens, they'll tell me. Sometimes we like hold our breath and then run forward and hug and then run back. Or like hug pillows next to each other.
Mm-hmm.
Yeah, but it is just, nothing is 100% safe. So it's just about lowering your risk. Like everything is harm reduction.
Right. Well, so we have gone through a lot of the questions that were sent in. So if there have been any questions since we've been talking that have come in, Esty, have there been questions coming in? All right. Well, no one has had any new questions, so we can just keep going through the document. Actually, one question just came in from Dina. What do we know about how the virus has like evolved or changed since we started sort of detecting it?
That's such a good and interesting question, because it's definitely this area where the science is always changing, but that's because we're learning more and getting like more pieces of the puzzle together. So you can almost sort of think of it like if we're looking at like the evolutionary history of like a series of fossils, but there are, areas where like maybe the animal lived, but like the soil wouldn't save the fossil. So you end up with this kind of patchy record, right? And that's kind of what it's like to try and figure out how COVID-19 has changed. So there are researchers who are using the genetic changes just to like try and track where the different strains are spreading. There's some evidence that the strain that's most dominant in the US right now, which came from Europe, is maybe less volatile. There's also some evidence that maybe like as a whole the virus is becoming a little bit less deadly, which makes sense, right? Like a deadly virus that forces all of us to stay in our homes, the ones that are going to get passed on the easiest are going to be the ones that don't make you stay in your home, or the asymptomatic ones. So there's some evidence that shows that it is getting a little bit weaker, and there's also like more transmissible, but also more asymptomatic cases, less deaths. But there's also, you know, we're still just kind of figuring out a lot of the research. It's still pretty early. But
so when that's another question that is always on my mind about this idea of asymptomatic carriers, is that, I guess the first part of my question is, does asymptomatic mean pre-symptomatic? You are currently asymptomatic, but you will have symptoms. And then how many of these asymptomatic cases we talk about, how many of those are people who just are carrying?
That is a question that I'm super glad you asked, because the answer to the first part of it honestly depends on like the context that it's being talked about in. So like, for example, the TRACE survey, which is a COVID-19 survey that Oregon State University has been doing in various towns to kind of help supplement OHA's surveys and just to try and get like a snapshot of a place in time of prevalence. And so the TRACE survey, for example, surveyed Hermiston during the height of an outbreak there, although now they're having another big one, and found that 17% of the people in Hermiston were probably had COVID-19 at that exact moment, right? But they aren't following up with these people. So like at that exact moment, we don't know who's asymptomatic and pre-symptomatic. You know, you kind of have to like look at the metaphorical study methods.
Right.
But the crazy thing is that even when you look at sort of the methods of the study, you start to realize that there's a lot of variation in rates of symptoms. Like in these, there are some well-documented cases that we have where people are kind of in an enclosed area, like on the cruise ships early on. We were able to see a lot of instances like that, where sometimes they had like a 70% asymptomatic rate, and then like sometimes they only had like a 20% asymptomatic rate. And these were people who were, you know, watched the whole time they were under quarantine, like the whole boat got locked down. And then we're also seeing cases where like, for example, say in New York, and actually in a large number of homeless shelters around the country, they're finding a lot of, they'll do a group test at the shelter and find that every single person there is infected and asymptomatic. It could depend on like how much exposure you get initially. It could be something genetic. It could be if you had a different type of coronavirus earlier that year, which would kind of explain regional clusters, right? Because you might have some immunity already to the virus. We don't know, but it's totally up in the air.
Right. And that's kind of why, you know, it's so important to always just kind of assume that you could be passing it on. Therefore, always wear a mask, always, you know, stay 6 feet apart outside, you know, make sure you're sort of doing a mini contact tracing of your friends before you hang out.
Well, and one thing that we do know about viruses in general, and that seems to maybe be true with this virus, is that generally how bad of a disease you get is somewhat dose dependent. So like if I spend, you know, 5 hours in a like conference center, say, with a bunch of other people, and we're all breathing the same air for 5 hours, you can kind of think of it as almost getting like just saturated with COVID. And so the more of that I inhale, the harder it is for my body to fight off that initial wave, right? And the better the chance that it'll get really severe before my immune system starts to respond. So there's some pretty compelling evidence that actually wearing a mask increases the chance that if you do get COVID, it will be asymptomatic, which is kind of cool. And then when you look at a lot of the places where they were having like widespread asymptomatic outbreaks, a lot of them are places where it's like outdoors, a lot of air, big spaces. But there's just, so many different possibilities, but just wear a mask, because I would rather be an asymptomatic transmitter than a symptomatic one. And that also means like asymptomatic to asymptomatic transmission, I wouldn't have a lot of the virus in me. So it's also more likely the person that I would give it to would have less of the virus.
Yeah, absolutely. So then we just got a question about home air purifiers. And, you know, I'm sure that there's now a market for, you know, more of a market for that. And, you know, do those work? And is there a way to sort of tease out the legitimate ones from, you know, companies just want to make money? Would that work for, say, you know, a group of 5 people coming over?
Yeah, I haven't really considered using an air purifier to like try and purify the air between me and other people. And it probably also depends on the capacity of that air purifier. But what I can tell you is that in terms of purchasing one, if this is something that you're going to look into, you should know that not everything that is labeled HEPA filter is actually HEPA. So I can't remember off the top of my head, but there's like a few other terms, like true HEPA is one, to know that it is like actually a HEPA filter and not branded, or you can look at the size, and you'd have to double check what size is ideal for COVID. I've been writing about smoke too much, so like that's what's in my brain right now is wildfire smoke HEPA filters. But you'll want to make sure that it filters a certain recommended size, and that will be on the box. So it'll say like true HEPA, and then like filters up to like down to like 1.2 microns or something. That's what you want to look for.
Great. And then so going back to mask, another question that came in is, are there different levels of effectiveness to, you know, our cloth masks versus those blue surgical masks versus the gaiters that, those are the ones, if people aren't familiar with that term, it's sort of like a scarf that people pull up over their nose. Is there any sort of big difference between them?
Yeah, so there's been some research done on a lot of different kind of DIY mask options, like, you know, like wearing a buff, those thin things that Joanna was talking about. I love my buff. I don't necessarily wear it for COVID anymore. But there's some research, honestly, not a lot. There was some research into like fabric types. There was one study that got a lot of press that found that wearing a buff like this might spread the virus more. And so that could increase the chances of an aerosol transmission instead of like droplets. And so they were like, don't wear buffs. But, you know, what most studies have found is that unless you're looking at like medical grade woven stuff, like an N95 or a surgical mask, among like your personal masks, just think about like, how comfortable is it? Because the more breathable it feels, that means it's doing its job a lot less.
Yeah.
But more so than fabric, honestly, what you want to look for is a mask that has a metal band to help it fit to your face. That's going to make a much bigger difference because you won't have air coming in through the gaps around it. And just think like more is better. So like if you're like me and like you like to run with a buff to pull up because it's just easier to breathe and like stays around your neck, I'll like fold mine over 3 or 4 times before I pull it up. It's just thicker, right? Like the issue is that it's a thin piece of fabric, so fold it up. And of course the studies didn't look into that. These are like all very, very basic pieces of research with teeny sample sizes. But just
right, yeah, that one study that you mentioned had its own issues too.
It did, yeah, exactly. Like it didn't look, yeah, it had a lot of science bias issues, but it was, you know, it was something.
Right.
Well, yeah, I would just say thicker is better. Like feel how much air is coming in and out, and don't get the construction N95s. Or if you do, well, so the construction N95s are great for smoke because they filter air coming in. They don't filter air coming out. They have a little one-way valve. You can put a mask over the one-way valve. That's what I've been doing with mine, but don't go around with like the valved masks and nothing else over it because you are not protecting anyone. And I see that.
Yeah, I see people with those, with the little valve on it, and I'm just like, you're not actually, like, it's sort of like the easier that you can breathe behind the mask, the less effective it is.
Yep.
Right? So you don't want to stop yourself from breathing, but you want to feel that there is a barrier over your face.
Exactly. And some fabrics feel nicer than others too. Like, you know, I try to avoid like any heavy polyester fabrics in them. So just kind of think about like, if you have a pillowcase that feels really nice against your skin and that feels like cool and not stuffy, maybe put that along the inside of like a thicker mask. So like, you can think about those things too. You know, you can like make a mask that's really effective and then give it like some type of modification to make it comfier.
And what about those face shields that people wear where it's just like a sheet of plastic? I always think that those aren't very effective because you're still breathing around it, right?
Yeah, and if you think about like how those would work, a lot of it is really going to depend on, you know, we now know that COVID is transmitted by aerosols, still kind of up in the air as to like what extent that makes a transmission. And it's also going to depend on like the situation that you're in. So like if you're in an enclosed space, wearing a face mask isn't going to do anything, especially if it's poorly ventilated.
And can you actually, before you go on, can you just define aerosol?
Oh yeah, so an aerosol, spreading in an aerosol means that it's in these super, super fine powders, or not powders, an aerosol could be a powder, super, super fine particles that are so small that they can basically like float in the air like a cloud. Like mist is an aerosol versus like kind of like a spitting rain. And I know I can like talk about like a drizzle versus a mist versus like
Yeah.
whatever here. Yeah, so I would kind of think of it like that. You know, one's going to have these fewer, bigger, more direct drops, and like a face shield is actually pretty good for that. Like if I'm sitting across from Joanna in an outdoor space with like a shield between us, I would feel safe because I'm not going to be coughing anything right on her, and the aerosols will get blown away. Indoors, aerosols kind of just float around on the breeze. A good metaphor is like, if it wouldn't protect you from cigarette smoke, it won't protect you from aerosols.
Okay, that's that's a great thing to think about.
Yeah, would you want to like sit next to someone who is smoking while they're wearing a face shield?
Right. Yeah, because the smoke will get out. And then a question that we got that I actually hadn't thought about, but now I'm wondering, can you get it through your eyes? I mean, that's another like hole into your face, right? So what about eye transmission?
You can absolutely get aerosols through your eyes.
Okay.
That is a thing. There was one doctor near the beginning of the pandemic who was convinced he got it through his eye on an airplane because he was being so careful. That being said, like, and eyes is like a big method of transmission for contact diseases, droplet diseases. So like you touch a door, you touch your eye, and that was a concern early on. Again, now it seems like surface transmission doesn't play a big role. So like you still shouldn't rub your eyes. And can you get it from an aerosol to your eye? It's an opening. It is a possibility. Your eye does not have a lot of immune cells in it. You don't have a lot of blood going to it. Your eyes are white. So there's not a lot of immune system going there. So it is a way in. That being said, like you have tears, you have kind of passive immune, and your eyes aren't very big. And your lungs, on the other hand, have a massive surface volume. You could spread out your lungs, and if you spread them out to a single cell layer, it would cover an entire football field. So that's a lot more places, right? Lungs are crazy. That is a lot more room for these viruses to attach to.
Right. So you said passive immune system. That is sort of the body's first line of defense, or what is that?
So that's things like your skin, mucus, tears. It's also things like your stomach acids, body temperature, the bacteria that you already have in you. A fever is considered a primary immune response, which isn't quite the same as passive, but it's kind of in that same category of like, these are your body's natural defenses. Like even animals that haven't evolved like this crazy immune system that can like memorize things and, you know, learn what they are and attack them and tag them and do all the cool things that our secondary immune system, which is what you would be activating if you get a vaccine, can do. There's still like most animals have that primary immune system layer. And so for us, that's also includes like macrophages, which are the big glumpy white blood cells that just kind of like eat anything that doesn't seem right. They're not very smart, but they just kind of like clump around, and there's really cool videos of them eating things in petri dishes. Highly recommend it. Like neutrophils, white blood cells, all of that stuff. It would also be your primary immune system.
Gotcha. So getting to some possible like COVID myths, is there, if somebody had a question about, you know, will getting the flu shot or, you know, taking extra vitamins like vitamin D, is that something that can protect us against COVID?
You know, so the normal answer to this is getting a flu shot cannot protect you against COVID. But turns out, because again, immune systems are weird, if your immune system is already like on the alert for an intruder, you actually might have some protective effect. But mainly get a flu shot so that you don't get the flu during the middle of a COVID pandemic. That would be really unfortunate. And also get a flu shot because getting one respiratory illness tends to make you more vulnerable to another, just because everything's all inflamed and messed up. Taking vitamin D. So generally there is again, some evidence that vitamin D, the homeless shelters that I spoke about earlier often use it as an example that vitamin D having enough of it can help you fight COVID-19. There's a couple like cellular reasons for it that aren't really important. But in some cases they have gone back and then say like tested these asymptomatic carriers and found that they don't appear to have a higher, like they don't appear to be any less vitamin D deficient than the general population. So there's all these ideas, they all kind of fall apart. Unless your doctor tells you to take vitamin D supplements, I probably wouldn't worry about it, but it is always a good idea to try and get like some direct sun on your skin fairly regularly. And certainly if your doctor says you need a vitamin D supplement, take it. You don't want to be vitamin D deficient. That is not good for your immune system.
Right.
But popping a bunch of vitamin D isn't going to help anything.
Yeah. So what do you kind of see for this flu season? I mean, it's sort of intuitively to me, it's like, well, if we're all sort of following the sort of quarantine guidelines, you'd think that there wouldn't be that bad of a flu season since we're not touching each other or being in the same room. But what do you think about, the interaction between the flu season and on top of this pandemic?
Yeah, I mean, well, one thing that we know is that COVID-19 is more contagious than the flu. It is just a little bit better at hanging out in the air and spreading and surviving. And so one thing that does mean is that the steps that we take to reduce our COVID-19 exposure are really going to help reduce our flu exposure. We saw in the spring that the flu season ended early, in part because people were worried about COVID-19. And then Australia, which is usually a good indicator of what our flu season will be like, because we tend to get the same strains they got during our summer and their winter, they had a really mild flu season, like record mild.
Wow.
In the US, I was just looking at CDC data for influenza-like illness and then COVID-like illness. And it does look like we're not seeing as much influenza-like illness as we normally do. I mean, again, it's, all up in the air, who knows, but like schools are hands down like the biggest vector of the flu. Flu loves kids, unlike COVID. And so while schools are closed, that's the biggest driver of the flu that's not open. So,
but still get your flu shot.
Yeah, get your flu shot, 100%. You just always should.
Right, yes. And then sort of another COVID spreader that we occasionally see news about is sewage. And so what has been the science around that? And are there cities in Oregon that are doing sewage surveillance? This is a question from our audience.
That is a great question. Most cities are now, which is cool. Sewage surveillance is kind of tricky because it's not going to help you pinpoint people, right? You're not going to trace it back to somebody's house, but it can be very useful for, say, determining if a city or neighborhood has a lot of COVID-19 when testing isn't readily available. So like, because testing in Umatilla County has been pretty iffy, OSU has been doing sewage testing for them, just to be able to say like, hey, you might not have had any cases this week, but look, it's still in your poop.
Wow.
So yeah, they're still finding a lot of it. And so it can be a good way to like kind of get an idea of whether or not there's going to be a big outbreak before test results are coming back.
Wow.
Yeah, it's a pretty useful tool.
That's
in terms of spread through feces, because it's so much easier to spread something as a respiratory virus, we aren't really looking a lot at it in terms of like spread from coliforms. But if you're like concerned about like, say, swimming in the Willamette River when coliform levels are high, which basically coliforms are E. coli that are associated with your gut. So they use it as a way to test for poop. Then yeah, I wouldn't swim if coliform levels are high, but I wouldn't do that anyway.
Yeah, so. Right. So on testing, Oregon, there was just this news that Oregon's getting, hundreds of thousands of more tests. So what does that mean? And what kind of tests are they? And does that mean that it'll be easier to get a test or maybe less confusing to get a test? I guess I should say, what does that mean for us as a state?
It's honestly really exciting. And I definitely there's like a big asterisk on that. It's really exciting, which is that no test is perfect. This test is not perfect. A negative test does not mean that you do not have COVID. That's the big asterisk. But yes, it's going to make it a lot easier to get tests. These are all rapid tests. These are rapid tests that don't need a machine to be run. It's just like when you get a flu test on that paper strip, just like that, or like a strep test. So most doctors' offices are equipped to do it. Right now, only ones with a certain waiver and license are allowed to, but they're trying to kind of expand that. It's just some FDA rules. But yeah, these are super easy to administer. They cost $5. Like, they're a great test. Now, they are not the most accurate test. They are far from being the gold standard like RT-PCR is. We used to have to confirm any of these antigens are like little bits of viruses. So these ones turn a color when they have a chemical that binds to a certain specific virus bit. So when these antigens change color, you have it. These antigen-based ones are not as accurate as RT-PCR is, which means you're going to get more false negatives. But part of the issue right now with PCR is that it's really time consuming. It takes a long time. We're really short on reagents, and we're seeing, you know, cases where like they do a mass testing event in Malheur County where they turn up 600 new cases in a day.
Mm-hmm.
And then that hasn't happened. It wasn't 600, but just
Right.
a hypothetical. But then if it takes them a week to get back all of those test results, during that time, all of those people have spread, and then contact tracing becomes impossible.
Mm-hmm.
So these tests are they're almost more of like a piece of data. Mm-hmm. So like if you have a negative test and you are sick, your doctor is supposed to have you tested again.
And this is with the new rapid tests. With
the new rapid test or with any test, honestly. Like the guidance is that if your doctor suspects you have COVID-19, you should get tested again if you get a negative test. Like assume it is a false negative.
Yeah.
And even like a negative test won't even rule out a COVID, take you off the COVID diagnosis list necessarily. Because sometimes it's just the only thing that's around to make you sick.
Right.
But yeah, they'll be way easier to get. They're distributing them primarily, actually, I wonder do you know if that's what you guys are doing? Are you guys using the rapid test for your event?
I think our event is PCR.
Okay, yeah. So these rapid tests, they're kind of democratizing our testing to some extent. And yeah, we'll be getting about 60,000 a week, I believe. Which is a ton, but it's still not enough. Like 60,000 new tests a week is more than doubling our testing capacity. But at the same time, like we have just, for example, 500 or like not 560, I think it's closer to 700,000 students in Oregon when you also count college students. So like you couldn't say test every single student with that many tests. It's just, this is a good contact tracing tool that's going to give quick results that we can then quickly get to contact tracers and then quickly give to doctors. But again, like if it's negative, there's every chance that it is a false negative. I think at this point, I kind of think that public health officials have kind of given up on like the idea of there being a good, accurate, fast test for this right now, at least in the US. So it's good. It's a good thing.
Yeah. Because even though there's a chance for false negatives, if you have symptoms, which is the reason you're getting the test, and you get a negative, right? Like if you have symptoms, just, you know, be cautious, wear a mask, don't go out, self quarantine, that kind of thing. If you don't have symptoms and get a negative test, you should still act like you have it, correct?
Right. And the big way that these tests are changing how you can get tested, besides making more tests more quickly available in more places, is that because we have more tests now, OHA was able to kind of change their testing guidelines again. So you might remember that like originally you had to have like symptoms and a doctor's note and confirmed contact with a previous case in order to get tested and all of these things. Now you can get tested if you are asymptomatic and have confirmed or suspected contact with COVID-19. So that means like contact tracers can now direct people who might not have symptoms to go get tested. And that's going to be huge because that's been a big gap in our contact tracing up until now. And that also does mean that, you know, you still need to when you go to get a test, you still need to have a screening. And if you think you might have been exposed, make sure that you say that and are very specific about how, because if you are asymptomatic and you just show up, tests are still kind of ration, and it's kind of the idea is like doctor's discretion. So like you definitely get a test if you're in these categories, everyone else, maybe not. So definitely like use the magic phrase and be like, I have a suspected COVID exposure. Like if you think you might have been exposed. Right.
Great. Well, it's 6 o'clock. So we are technically at the end. If anyone has any, more pressing questions, feel free to pop them in the chat or unmute yourself at this point and just yell it out. I mean, we're at the end, so we can also just wrap this up.
I have a question.
Yeah.
So you mentioned a number to be aware of for the true HEPA filter. Can you tell us that number again about the air purifiers?
Yeah, and actually I can get you the exact numbers too. One of my coworkers is like really obsessed with air quality. So the phrase you should see is I'll type it into here so that you can see how it's written. True HEPA or captures, what was it? And if you can get a number that's smaller than 0.03 microns, that is even better, because the smaller it gets, the better it is. But that is like, officially that would be HEPA qualifications. Now, viruses can be a little tricky, and things that capture as small as doesn't mean, like, it will capture products smaller than that, but at a less effective rate. So that isn't like quite the limit. You know, again, like, no air filtration system that you can buy at a grocery store or at a regular store is going to make you 100% safe. But
Sure.
yeah, it never hurts to be extra safe, especially as we have friends over in the wintertime.
Yeah.
Especially if we can't keep windows open anymore. So.
Okay, thank you.
So then for outside, I think there's some confusion about whether you need to wear a mask when you are hanging out with people outside. So like, what are the guidelines for what mask wearing outside, and versus, is there like a distance for when you can take off your mask? Like what is?
Yeah, in Oregon, the rule is, the official rule is that you need to wear a mask when you are outside if social distancing isn't possible. So, you know, technically that would be if you're less than 6 feet apart, you need to put the mask on, but like, I think it's polite. And also I want to encourage people to put their masks on too. So like, when I'm walking down a street and I don't have my mask on, as soon as I see somebody else, I will put mine on. And I've gotten very good at very pointedly putting mine on in a way that makes them go, oh yeah, okay. And then picking up the mask that they have hanging around their neck. But like, no, it's not the rule that you need to wear one on the trail. Obviously, everything you do makes you safer. So wearing a mask when you're hiking on a trail the whole time is not going to hurt you. And it will probably also help you. But outside, the risk of transmission when you're more than 6 feet apart is really negligible, especially on a windy day. So like, Oregon's rule seems to be pretty in line with what the science is on this one.
Yeah, for my own personal life, when I walk around, so I live in the Northwest neighborhood off of 23rd. When I'm walking around, I tend to, just because so I can breathe easier, I tend to lower my mask when I'm on a street where there's one person across the street or nobody. But if I'm walking on 23rd or on 21st, where there's like a lot of people, usually I will put my mask on as I'm passing restaurants that have lines out the door, that have people sitting outside. But if I'm the only person around, I usually take it off. And so I see another person, because it really is just about sort of just being in line with what people feel comfortable with. When I'm spending time with a friend outside, we always ask each other, like, do you want to wear a mask? And some people say yes, and some people say, as long as we're 6 feet apart, you know, I feel comfortable, especially if it's a breezy day. So it's about your comfort level. But yeah, if you can't stay 6 feet apart, then definitely wear a mask outside.
Yes.
I have a question. About drinking water. If it can be detected in sewer water, which is treated and then usually put back into the environment, are they testing our drinking water? Or would a virus be able to exist through all the various treatments that drinking water goes through?
Almost certainly not. Definitely not in Portland, thankfully. In Salem, where the water filtration system is slow sand, if they were to somehow get COVID-19 into the water before the filtration system, they would get sick. But that being said, they don't draw their water from like the groundwater. They draw their water from the Santiam River, so that's runoff. And thankfully in Oregon, most of our water comes from aquifers and things like that. Like, the water that we put back into the ground here is not going to make it back into our drinking system, which is very fortunate, because it's just one of the benefits of kind of being at the bottom of a high elevation state. So everything's just going to keep on going out, and we draw our water from snowmelt. And yeah, virtually all treatments are enough to remove viruses from water. The issue with Salem's was like a pretty specific and weird circumstance brought about by toxic algal outbreaks. So no, it's not something that you should be concerned about.
Super.
Yeah.
Well, did I miss anybody in the chat? Or if anybody else has another question, feel free to shout it out. Otherwise, I think we can wrap it up.
Okay. Well, thank you all so much for having me, and thank you for inviting me, Joanna. This was
Yeah,
wonderful.
this was so wonderful. I hope you learned a lot. If you have more pressing questions, feel free to email us, covid19@neveshalom.org. We will get those answered for you. Thanks so much, everyone. Have a great night.
Bye.